My name is Dennis, Dr. Dennis Sebastian. I work as the Regional Director for the Reinsurance Group of America. We are a life and health reinsurance company based out of the United States of America. We've been in the global market for a little over 43 years and have our presence in the Middle East for the last 4.5 years. I lead the health initiative for the Reinsurance Group of America for Middle East and North Africa. That's a bit about myself, all right? And from this session, the discussion that I had largely was on the trends that you see in the GCC countries as far as health insurance is concerned, and what should be the role of the employer in specific to contributing to better bottom lines and better profitability for all the stakeholders of this health insurance.
How has mandatory health insurance affected the region? Can you tell us a little bit about the pros and cons?
Yep. Compulsory medical insurance has been introduced in Saudi Arabia, in UAE, in Qatar in a very high level, in Kuwait in a very high level, largely for expatriates. Saudi Arabia, I think, has implemented it in 2006, and today they have a little over 7.5 million insured individuals, insured expatriate individuals in Saudi Arabia. In the UAE, Abu Dhabi was the first to implement it, and today even Dubai has implemented it since a year. They have the good thing. The good thing is that the more countries implement compulsory health insurance, it reduces the government expenditure, or the government expenditures on health for the expatriates, and it surely promotes the growth of the private sector for all stakeholders: insurer, reinsurer, medical service providers, suppliers, everybody. There's a considerable growth on the private sector, so to speak. So compulsory medical insurance or health insurance in some way or the other surely adds value to all the stakeholders. Now, from a government perspective, in a country or in this region where taxation is not so common, I think they have to look at alternate sources of financing for ensuring that there is maintaining the quality of this ever-rising healthcare expenditure. If they don't contain it, governments will just access the public sector providers more and more freely and receive more and more treatment freely, with the government spending more and more, which may not be a sustainable model. That is why the governments have thought about alternate sources of financing and promoted the concept of a compulsory medical insurance for expatriates. And in this part, expatriates don't pay any taxes. So I think that has also promoted the growth of the private health sector. Maybe 10 years ago, you would have seen a handful of private hospitals and service providers. Today, you see a lot more of private sector hospitals and service providers because they know there is a market, there is a demand, and there is a limited supply for it. So I think it has only helped the market. The only flip side of it that I see is there is an increased cost to the payer. Like the employer would have an additional cost. Previously, he may reimburse the health expenditure. Today, he's got a fixed cost, and if he doesn't manage it properly, his cost on a year-to-year basis will keep increasing. So I think that's about the only flip side. But I guess that's part and parcel of any economic development, I guess. But overall, for all stakeholders involved, it's been positiveness. It has been progressive up until now, and it will continue to be that way.
And what is the status of health insurance in the Middle East when compared to developed nations? What steps need to be taken to improve this?
The status, the per capita expenditure in the GCC for healthcare is about $913 per person. This compared to developed countries like United States is about $7,600 per person. So it's a far cry. It's a very huge system. I think the steps that they are taking to improve up until maybe 5 years ago, the public sector dominated the healthcare service provisions within the region. You would have expected 80% of expenditure, if not a little more, from the public sector. Today, you would see that at about 70-30. In some countries, even 50-50. Like in UAE, it's well balanced. The public sector's expenditure and the private sector expenditure is almost 50-50. So I think the governments are taking the necessary steps to implement or rather execute a better growth of the private sector. And the more the growth of the private sector, the more the utilizations or rather more accessibility at that particular place, and the more expansive the healthcare delivery system would improve. The better it improves, the better the competition. They compete on prices, compete on services. The demand would only keep increasing with more and more expatriates and nationals also now coming into separate schemes. So demand for private health will only continue to grow. So the more demand, the more demand, not just in terms of services, the more demand in terms of quality of service. So yes, initially it is accessibility. Once I have access to a provider and becoming a payer, I demand quality. So you have to improve your quality if you need me to access you in the future. So I think it will only add value to the growth of the region.
And how do you think the MENA Health Insurance Congress helps address the current challenges?
It's my first attempt, or rather first time I'm attending this conference. I think it's been a wonderful session. I mean, it's a good mix of audience. I think it's a mix of audience from both the healthcare industry and the insurance industry. So I think there is something in it for everybody. And I think I would not know how you address the challenges. You would know that better because that's your strategy. My strategy is to add value to your discussion. So I guess through a couple of events and bringing everybody together, them collaborating amongst themselves, I guess you are surely adding a lot of value. You're not being selfish to a particular segment. You are promoting the concept of industry-wide or a healthcare industry-wide collaboration through a lot of events that you conduct, or rather through a couple of pluralistic events that you conduct. And I guess that's the way you are trying to add value, isn't it?
And so far, how did you find the Congress, and what is your experience of it? How has it been for you?
It's been nice. I mean, I've been here since morning, and I think it's been a good session. I mean, it's very supportive, very nice people to interact with, and I think it's been a good day so far.